You know, in the world of nursing, getting the right information can be the difference between good and truly great patient care. But here's the thing, getting that information isn't magic. It's a science, and it all starts with asking the right questions. So today, we're going to explore the art and the science behind the questions that really shape modern nursing.
This is it. This is the big challenge for every single nurse. It doesn't matter if you're right there at a patient's bedside or if you're analyzing a huge study. The quality of your answers is always tied to the quality of your questions. So let's break down the essential tools that nurses use to get the data they absolutely need.
Okay, first things first. When we talk about questioning in research, we're not talking about just a casual chat. It's a systematic process. You can think of it like building a precision instrument, maybe a really detailed questionnaire or a carefully planned interview, all designed to gather very specific insights into what people think, believe, or have experienced.
So, here's our roadmap for today. We're going to start with the basics. Then we'll explore the two major pathways for research, the open-ended and the closed-ended. After that, we'll dive deep into the specific tools in that closed-ended toolkit, and we'll wrap up with the really critical decision, how to choose the right question for the job.
All right, let's start at the foundation. You see, at its core, all questioning is really about inquiry, right? It's about being curious. But in a research setting, that curiosity needs a framework. It has to be structured so you can get reliable results. And that structure? Well, it leads us to a major fork in the road.
And this image right here, it perfectly captures those two main forks in the road for any researcher. Every single study starts with this fundamental choice. Are you trying to explore a topic freely, gathering all these rich, detailed stories? Or do you need to measure something very precisely across a large group of people? Your answer to that question is what determines whether you're going to take the open-ended path or the closed-ended path. First up, let's take a walk down the open-ended path. This is the route you choose when you're looking for discovery, for the story behind the numbers. These are the questions that just don't have a checkbox. They're basically invitations to have a conversation. Think about it. Asking, how did you feel after the procedure, instead of just, did you feel better? Well, that opens the door for the patient to share their experience in their own words, and that can reveal details you might never have even thought to ask about. The real power of this approach is in the authenticity of the answers you get. I mean, you get genuine, unfiltered thoughts. This is absolutely essential when you're exploring complex topics, like a patient's emotional journey, or their unique ways of coping, areas where a simple yes or no just doesn't cut it. You're capturing the whole picture, not just a little snapshot. But, you guessed it, that freedom comes at a price. Analyzing pages and pages of written text is way more challenging than just counting checkboxes. How do you compare one person's really detailed story to another's? And then there's the risk of getting off-topic information, and even the interviewer's own biases can subtly influence the responses they get. Okay, now let's switch gears and look at the other path. If that open-ended path was all about rich narrative depth, then the closed-ended path is all about structure, speed, and scale. With closed-ended questions, the researcher is totally in the driver's seat. They design the journey by giving you all the possible answers, whether that's a simple yes-no, a rating scale from 1 to 5, or a whole list of potential symptoms. The respondent's job is just to pick the option that fits them best. It's efficient, it's direct, and it's highly structured. And the real beauty of this method is its efficiency. You can survey hundreds, maybe even thousands of people super quickly. The data you get is clean, it's numerical, and it's ready for statistical analysis. That makes it so much easier to spot trends and make comparisons. Plus, because you're standardizing the answers, you reduce the risk of bias. But of course, that structure has a trade-off. What happens if none of the options perfectly capture how a patient really feels? You risk forcing them into a box that doesn't quite fit. And ultimately, you sacrifice all that richness and nuance you get from an open-ended answer. You get the what, but you often miss out on the why. Now, don't go thinking that closed-ended means it's one-size-fits-all. Oh no. Researchers have a whole toolkit of specialized question formats, each one designed for a very specific job. So let's do a quick run-through of the greatest hits. You've got your simple, dichotomous questions for a clear yes or no. Multiple choice is great when there are several known possibilities. Rank order questions help you understand priorities, like asking a patient to rank their most challenging symptoms. And of course, rating scales, like the famous Likert scale, are perfect for measuring the intensity of a feeling, from strongly agree all the way to strongly disagree. And believe it or not, it gets even more specific. A forced choice question actually removes the middle ground, forcing a respondent to lean one way or the other. And a cafeteria question? It's exactly like it sounds. It presents a menu of options, and you just pick the one that looks best to you. Each tool is designed to shape the data in a very particular way. And finally, we have filter questions. I guarantee you've seen these. They're the classic, if you answered yes, please continue to question 5 kind of prompts. They're fantastic for creating a personalized survey path, making sure people only answer questions that are relevant to them. The only little catch is that if they get too complex, they can sometimes end up confusing people.
So after exploring both of these paths, we finally arrived at the most important part, the decision. How does a researcher choose which tool is actually right for the job? Honestly, this quote just nails it. It perfectly sums up the core dilemma. There is no single best type of question. The choice is always a strategic trade-off. Are you digging for gold with a small team, hoping to find those deep, rich insights? Or are you surveying the entire landscape to get a broad, comparable map of the terrain?
Think of this table as your ultimate cheat sheet. On one side, you've got open-ended questions, which give you rich, qualitative stories, perfect for discovery, but tough to analyze at scale. On the other side, closed-ended questions deliver clean, quantitative numbers, perfect for measuring and comparing, but they can lack that nuance. The key takeaway here is that neither one is better. They just serve different, but equally vital, research goals. And all of this leaves us with one final thought. In nursing, we absolutely need hard data to measure outcomes and test new interventions. But we also need to understand the human story behind illness and recovery. The real art of nursing research isn't about choosing one over the other, but knowing when and how to use both to truly improve patient care. So, which one do you think is more vital?